Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic, and Campaign 2018 partner Milwaukee Journal Sentinel.
WisconsinEye is in Marshfield interviewing Brian Ewert of Marshfield. He's a Democratic candidate for the 7th Congressional District. Dr. Ewert, thanks for talking to WisconsinEye.
Thank you for coming up to Marshfield.
One of your brochure themes says this. I want to understand it. We live in communities, not political parties. What does that mean?
Well, our national problems, for the most part, are not Republican problems. They're not Democratic problems. They are issues of how do we strengthen the foundations of our communities. I think particularly here in the 7th Congressional District, which is almost 20,000 miles of the northern third of Wisconsin, what we really have is rural problems. And so we have rural healthcare problems, we have rural infrastructure problems, rural broadband problems, and rural economy problems. So what I envision of being in Congress is to find other representatives from rural America and partner with them on helping solve those problems. I'm sure Western Nebraska has the same challenges with broadband and infrastructure and healthcare as we do. And so my aspiration is to be able to work with other representatives, regardless of party affiliation, to solve the problems which are at the core of what can strengthen our communities.
Is that issue number one with your campaign, sir?
Yeah, I think it's a major theme. I think healthcare is probably the major issue. Partly is it's the top of mind issue for most Americans. They continue to be concerned because we have people who are uninsured, and more importantly, we have a large group of people who are inadequately insured. And so they are very appropriately concerned that a health crisis will immediately trigger into a financial crisis.
Now, you've been a physician in Marshfield for
25 years.
25 years.
Yeah.
So you have seen some of these healthcare issues, dozens of them, hundreds of them, thousands of them.
Yes.
We seem to be at a crossroads in America on healthcare. What should be our next steps on healthcare?
I think our next step is to open up the Medicare option for all. It was an idea considered at the time of the Affordable Care Act was being considered, which is the public option. This way, people who are uninsured or inadequately insured have the option to join a very large pool, which is the Medicare pool, which helps in terms of both controlling the price of the insurance as well as provides the adequate bargaining power to control the cost of health care.
How do we phase into that, especially with 2 more years remaining on President Trump's term?
I think part of it is that certainly he advocated during his campaign of bringing healthcare to everyone at a lower price. This is the solution. This actually provides the how for what he set out as a vision, which is to get healthcare for all Americans at a lower price. Senator Murphy from Connecticut has already introduced the bill in the Senate, and so we already have the framework of this legislation. We just need to have it work through the legislative process and have Congress do its job of working to solve problems for the country.
Can you expand on the issues of rural healthcare in the 7th District, sir?
A lot of it has to do with where we deploy what resources. And so it has to do with where do CT scanners go, where do MRI scanners go, more importantly, where do the specialists go? Because in order to have specialty care, it does take an incredible team. So as a kidney doctor, I certainly have my own expertise in terms of how to take care of people with kidney failure, but I definitely need an incredible team of surgeons and radiologists and nurses and dialysis technicians. And so it's bringing that entire team together and finding the appropriate locations. And then it has to do with how do you build the transportation and information infrastructure to make sure that when people do become sick somewhere up Highway 13, that they can get down the road to the medical center. And whether that go to Wausau, Marshfield, Eau Claire, our major centers, that's what we need is for patients to be able to get the right care close to home, as well as the specialty care within a reasonable both time and distance amount.
What's at stake as the Trump administration continues to remove some pillars of the Affordable Care Act? If it's not universal health care, what's really at stake for the 7th CD?
I think what's at stake is that the people who most need health care are put most at risk. And that is certainly, there were issues with the Affordable Care Act. There are issues that need to be fixed. It has to do with the high deductible health plans, which I don't think the policymakers saw coming 10 years ago when they were crafting the legislation, because now we have extremely hardworking people who happen to have income just above the 400% of federal poverty. So they don't qualify for subsidies on the individual insurance exchange. Those people, I've had them in my office. They'll come in and say, they're responsible business owners. They actually have $10,000 in their health savings account. The problem is the person I'm seeing has kidney disease, their spouse has a cancer, and the quote was, "We're good this year, but you have to cure me by December 31st, because on January 1st, I don't have another $10,000. So I think the current issue is chipping away at how we do keep premiums controlled. And that is the biggest issue with the cost sharing reductions that weren't reinforced, and now going after the essential health benefits, and more importantly, these association plans, which creates really fake insurance. It's not really health care coverage. And by doing that, you pull healthy people out of the insurance pool, you leave the more ill people in the pool, and that's what creates the insurance death spiral, where eventually the only people left seeking insurance are those who have active medical problems. Creates two problems. One, for those who currently have problems, but it also creates problems for those who thought they were healthy, because all it takes is one disastrous accident on the mountain bike or one unfortunate diagnosis in the office, and all of a sudden people move into that group of patients who are needing to consume a lot of health care and need to have that coverage.
Last question on health care, I promise. Are residents of the 7th CD healthier because of the Affordable Care Act, sir?
Absolutely, they got access. And I think the people are healthier because 27,000 people in this area got access to health care. It also helps businesses be healthier. And I think this is the part which gets lost sometimes. When you have a large pool of uninsured patients, we have healthcare delivery systems here in the 7th Congressional District who are obligated and morally feel the obligation to take care of those patients. But somehow those costs have to be covered. What that happens is the only way to cover those costs is to raise the prices for the paying customers, which are the businesses who are buying insurance. This is one of the reasons why when you cross the St. Croix River, all of a sudden premiums drop dramatically into Minnesota. And it has to do with historically how they covered healthcare costs in Minnesota versus Wisconsin. So by expanding healthcare coverage to everyone, it's a very pro-business move because it helps businesses lower their costs. So they're covering the costs of their employees, but they're not being asked to have a hidden tax where they're covering the costs of the uninsured.
New subject. If you're in Congress, if you're in the U.S. House, what would be the elements of a immigration reform package that you would support?
I think there's several pieces to that. First of all, we do have the Dreamers. These are people who came to the United States as children. They were minors, and now they have shown that they are law-abiding, hardworking residents of the United States. Some of them are veterans, others are professionals. They have joined our culture, they have joined our society. So clearly they need a pathway to citizenship involving being law-abiding, hardworking, contributing members of our society. The next is the 11 million people who came here as adults. They are also have become an integral part of our economy and our communities. So we need a pathway to legal residence for them. They did not come here through legal means. So I think that's where you start drawing lines. And as adults, they came here through means that weren't legal. But they do need legal status because they're playing a crucial role. Here in Wisconsin, it's $8 billion worth of economic activity contributed by the undocumented workers here in Wisconsin. And our businesses desperately need them. I hear from dairy farmers that they would be happy to only hire people they're assured of full citizenship. They can't find those people. And they have 500 cows that need to be milked 2 to 3 times a day. And without that immigrant labor force, they can't get the work done. The other part, the reason why legal status is so important, is the way in which it strengthens our communities. When people are here and they're not here under legal status, if there's a crime being committed next door, the person is very hesitant to call law enforcement because they're worried that they will lose their ability to stay here in the United States if law enforcement comes to the neighborhood. So that weakens our communities. So we definitely need to strengthen our communities by having sound immigration policy. I think this gets back to an issue of that we live in communities, not political parties. 2013, bipartisan bill passed the Senate on immigration. Not a perfect bill, but at least it started addressing these concerns. Unfortunately, it went to the House of Representatives where it never even got a hearing, it never got amended, it was never considered. So I think it's crucial that Congress start acting on the problems faced by Americans in our communities and faced by American business people. Last point I'd like to make on immigration, another reason to make sure that everyone has legal status in the workforce is it protects American workers. Because another part of having non-legal workers is that they have been abused by certain employers to underpay and undercare for employees who are not here under legal status. So it's actually crucial for the American worker to have a sound and fair immigration policy.
You use the term legal residence. Does that stop short of citizenship?
I think for people who came here through less than legal status, yes. I mean, I have hardworking colleagues, they're international medical graduates. Many of my colleagues came here and they've worked hard, and I recognize how hard they have to work. We'll get 24 hours notice when they have to get to Milwaukee to complete their citizenship work. And our job is to always say, we'll take care of the patients, you go get your citizenship work done. So it's an arduous process. And I think just really want to always respect that. Met a woman last week who'd been in the country for 38 years and is just now getting citizenship. So people have worked hard on this, and I think we need to respect when people have truly gone through all the processes of becoming legal citizens.
Follow-up question on immigration. Some U.S. House Democrats, including Representative Mark Pocan, are calling for the repeal, get rid of ICE. Your position on that?
Yeah, I think we need to look in terms of how the law enforcement. So I think in regards to the ICE itself, it has to do with, are we operating under the rule of law? And I think it's making sure that Congress has passed its policies. One of our current problems for the last 8 years is Congress has really been negligent at crafting policy and passing sound laws, leaving the executive branch for executive decisions. And so you have these executive orders come down. Of course, President Obama had one set, President Trump has another set. And in that, you really end up with this almost executive chaos, that people don't know which way the law is. So I think it's not so much whether there's ICE or there isn't ICE. I think it's having sound policy and legislation underneath what their task exactly is and how they carry out that task.
You mentioned talking to dairy farmers in the 7th CD. Are they also worried about tariffs?
It's a huge problem. You know, it's interesting that when we talk about tariffs and international trade, the Constitution does not enumerate that many specific powers of Congress. But it turns out two of the enumerated powers of Congress in Article 1 is international commerce and setting tariffs. Mm-hmm. Now, over the years, Congress has passed legislation and delegated that to the executive branch, which is certainly their prerogative. But if it's been delegated, it can then be pulled back. So 107 Republicans sent a letter to President Trump in March to advocate for the hardworking people in their districts, including some of the representatives from Wisconsin. Unfortunately, Congressman Duffy's name is missing from that letter that was written by Republicans to President Trump advocating for the workers of Wisconsin. So in terms of dairy, 50% of our cheese goes to Mexico. This is hugely disruptive. The price of cheddar is now at a 10-year low. Meanwhile, the storage of cheese is at an all-time high. This is a huge problem for our dairy industry because it took them years and years to develop these global relationships for markets. They worked hard to do this, and now they're being destroyed in a matter of weeks. It's going to be a long road back. And meanwhile, dairy herds, you obviously just can't flip a switch and bring them up and bring them down, not to mention the infrastructure. I think the other problem with the dairy farmers is they're getting squeezed on both ends of this tariff. One is the price of their product is plummeting. At the same time, if it's time to put up a new shed, it turns out the price of steel has risen dramatically. And so they're getting caught on both. What does it cost to be in business, to buy new equipment that's made of steel, the price going up, meanwhile getting a lower price for their product?
The Trump administration sent Congress a budget that would dramatically increase military spending. I think it would take it to more than $700 billion a year. Could you support that increase?
I do have problems with that because already the United States, of the global amount spent on the military spending, the United States is 35% of that. So we are a substantial amount of military spending. Russia is at 6%. I mean, so one of our larger adversaries, in the geopolitical world actually spends much less than we do. I think it comes down to a larger discussion about national security. And national security involves the 3 Ds, and defense is one of them, and it's very important. We certainly, in terms of supporting our troops and making sure that they are well equipped and well trained and well cared for. But then we also have diplomacy and we have development. And in addressing those other areas, you decrease the need for the defense if you've built the partnerships. I mean, it was 75 years ago, we were spending an enormous amount of money at war with Japan and Germany. And now we spend nothing being at war with Japan and Germany because they are our trading partners, they are our defense partners. So building those relationships helped all of the world economy, including the United States economy, grow. And it really does come down to what President Eisenhower said, that every dollar that goes into defense means it's taken away from strengthening our communities. So we need the right size of defense, but I think we need to continue to work on what can we do to decrease tensions in the world so that we have less need for spending on military, and we can devote those to development and diplomacy.
You've called for a new tax structure. In light of the tax reform bill passed by Congress, our deficit is now $21 trillion. So, well, the first question is, what changes would you work for in terms of our tax structure?
You know, I think that that tax law that went into effect in December is another example of how Congress has really failed the country to address the needs. Couple issues. One is, while Congress was working to give tax breaks to billionaires, children with leukemia had to wait in line because the Children's Health Insurance Program was not renewed during that time. Eventually was renewed, but first the billionaires had to be served first. So I think some of its priorities. But then in terms of tax structure, clearly we are entering into a time of economic expansion, which is an excellent time to work at making the tax structure more fair. And that can address the issues of payroll tax, which is Medicare and Social Security, as well as income tax, which fund up the rest of our collective public pool of resources. So I think we need to continue to look at how do we make sure that those people who are struggling the most have the least burden, whereas those who have the most privilege bear the appropriate amount of responsibility for funding up and strengthening our communities. So it has to do with fairness. It also has to do with being careful. You know, certainly in medicine, when we take an action, we always consider what are the risks, what are the benefits, and we try and be extremely skillful and mindful about how we go about making decisions. The tax law was being passed in the dead of night with notes scribbled in the margin of all things. I don't know if it was an intended or unintended consequence, but one of the results of that tax bill is it moved the fiscal cliff of the Medicare Trust Fund 3 years closer. It was 2026. And as Secretary Azar, as one of the trustees of that trust fund, reported in his report, that has now been moved up to 2023. And it's because of that very tax bill. So a consequence of that is we're actually imperiling the health care of our elders who have earned the right through paying through their payroll taxes all those years to have health care. And now we're putting that at risk because of a tax law that either wasn't skillfully considered or actually was intended to hurt the very people we have obligations to care for.
But the governors of the Social Security Administration, Social Security system, say it's going to run out of money in 2034.
Right.
So how do we address that issue,
Right,
which also affects the elders?
Absolutely. And you know, one of the greatest programs to change the structure, the number of people in poverty, was Social Security. Prior to Social Security, retirement almost always meant impoverishment. Clearly one of the greatest programs that we've had in the history of our country. The good news is at least we have a longer runway to fix this. But that's again where we have to look at the issue of payroll taxes versus income tax. And plus with Social Security, it turns out it is naturally puts a larger burden on those at the lower end of our economic spectrum than the higher end, because after about $130,000 of income, there's no more payroll tax. So there are ways to restructure it. I think we need to be careful because everybody who works pays taxes, because payroll tax starts at $1, and that's the 1.5% tax on Medicare and the 6% tax on Social Security. So everybody who works pays taxes, but we need to make sure that's a fair structure so those who most need to have food security and housing security and transportation security, we focus on that, whereas we make sure it's fair so that everyone is paying their fair share.
Should there be a means test to collecting Social Security?
No, Social Security, I think clearly we have hit a point where people, there's a base at which definitely people have earned that right. They have paid into it. And so there is this obligation that people have earned the right to receive that and have structured their retirement around that for all these years. It is an obligation made, and it's definitely an obligation that needs to be kept.
President Trump and other Republicans in Washington have doubted that climate change is a threat to the world. Your position on climate change?
Well, I think they should make a trip to Ashland up in northern Wisconsin and notice that in the last 3 years there have been 2 500-year floods. Right now, Chequamegon Bay looks more like a farm pond than the pristine waters of Lake Superior because of how much sediment washed off in the last flood that washed out Highway 2, which will now be out for months. So clearly, along with that, the city of Ashland sewer treatment plant was overwhelmed, so there were millions of gallons of sewage that poured into Lake Superior. We're already having the effects of climate change. Clearly, 5 feet of water dumped on Houston last summer. The scientists agree that came from the warming of the Gulf of Mexico. This was not a one-off event. This is a trend that has been substantiated. It's time to move beyond discussing about whether or not it's there or not. In some ways, I guess I would say the climate doesn't care what we believe. The climate is changing. It's our duty to respond. Fortunately, in responding, we can grow great jobs. We can work on solar panel plants. We can build windmills anywhere in the United States, including northern Wisconsin. And the people who install those types of devices also are highly skilled people. It's licensed electricians and contractors. So it is a win-win situation in terms of fixing, helping grow our economy, at the same time addressing a clear and present danger to having a planet that's habitable for humans.
In response to mass shootings and school shootings, do we need to change our gun laws?
We do need to keep guns out of the hands of dangerous people. And to do that, we need to actually enforce the background check laws that we have. Some of the most worst gun disasters we've had, the shooting in the Charleston church, the shooting in Texas, those people, if the background check would have gone through, they would not have gotten guns. So the first is to actually have background checks that work. The next is to make sure that we have red flag laws. So if people have shown a pattern of behavior which is showing they are acting irresponsibly, and just like with every other constitutional right, there is always coupled with responsibility. And so if people are behaving in a way that demonstrates an irresponsible and dangerous way, you have a judicial process, just as we do with other constitutional rights, so that person does not have a weapon. The other thing we need to do is do the serious research. Certainly here in northern Wisconsin, it's about 10 times more likely that a death from a gun is due to a suicide instead of a homicide. We need to pay attention to the risk of guns in the home, not for homicides, but so that people who have guns in their home, just like I have done, keep them locked and keep them protected. Particularly if someone else in the home is showing signs of depression or despondency, you recognize that protect your own family. Make sure those guns are safe. That means fully repealing the Dickey Amendment, which is the amendment that was interpreted to bar the research on gun deaths in the United States, and at the same time actually promoting it. If we had 30,000 deaths per year from Ebola virus happening in the United States, we would have the CDC's full force going in to find out why and what to do to prevent it. We need to take that same approach to anything that causes that much loss of life. Same time, preserving the rights of those millions and millions of gun owners who very responsibly exercise their Second Amendment rights, but recognizing we have a very small subset of people who are irresponsible. We need to address that.
Some Democrats in the U.S. House say if our party takes over next session, they should initiate impeachment proceedings against President Trump. If you're part of that new majority, your position on that?
I think impeachment is an incredibly serious undertaking in terms of what the Constitution puts a responsibility on. At this point, I certainly am not aware of anyone having brought forth that level of evidence. I mean, clearly, Robert Mueller is doing his job. He should do his job. He's the best one to do his job. So clearly, we need to see what evidence comes forth. But it's a constitutional process. It needs to be taken extremely seriously. I mean, what the people of the United States want us to do is to solve their problems in their communities. And getting lost in partisan fights is not helpful. In fact, that's what seems to disgust people the most. They are tired of the bickering. They're tired of the partisan grandstanding. They need us to solve the problems that are happening in their towns and in their states and in our 7th Congressional District.
And if you're part of that Democratic majority in the next U.S. House, would you vote for Nancy Pelosi as Speaker?
You know, I think I would weigh that very carefully. She clearly has had a long career of service, but I think would definitely need to assess what leader was most going to help the constituents here in northern Wisconsin, because that's my duty, is to serve the constituents in northern Wisconsin, all 700,000 of them. That's what's most important. Representative Cowley found out in the New York race what happens when you focus on what the Washington power process, and that's why Alexandria is going to be running for the House of Representatives.
That's true.
And so I think it's very important you stay focused back home, because that's the calling, that's the call to service.
Last question. You have a primary opponent on August 14th. Do you want to highlight differences between you and your primary opponent and also with the incumbent, Mr. Duffy?
Yeah, I think in terms of why I got into this is I have 25 years of caring for people here in the 7th District as a kidney doctor. I also have years of leadership at the Marshfield Clinic, having been president of the Marshfield Clinic and having that leadership honored and with an endorsement from Congressman Obey, State Senator Jauch, the previous candidate, Mary Heft. So I think first of all, that leadership, that history of leadership, I had to solve problems, bringing everyone together. Initially they weren't agreeing, but we had to work through those problems because we had to take care of patients, just like I do when I go in the intensive care unit. It's about solving problems, creating solutions. So I think that that caring, that leadership, and then just my family culture is one of service, goes back generations. Long before I considered political office, worked with Habitat for Humanity, worked with food insecurity. We have worked throughout this region in terms of addressing the needs of the communities and bringing those skills of caring, leadership, and service is what I think I have to offer to the people.
Thank you. Brian Ewert of Marshfield is a Democratic candidate in the 7th Congressional District. The primary is August 14th, the general election November 6th. Dr. Ewert, thanks for talking to WisconsinEye.
Thank you very much.
Thank you.
Yeah.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic, and Campaign 2018 partner Milwaukee Journal Sentinel.